Hey everybody, it's Dr. Paul Thomas with Plum Health EPC, and I wanted to bring your attention to this show called An Arm and a Leg. It's a podcast. It's produced by Dan Weissman out of Chicago, and I think it's a really interesting podcast. I've listened to a few episodes. One of their latest episodes was about a woman with chronic back pain and how there are no great treatments for back pain, and how if you go to a doctor for back pain, they will give you multiple different treatment options because there really isn't a gold standard on back pain management. And this can lead you down a rabbit hole of eventually getting surgery, not having a great outcome, and perhaps even becoming addicted to pain medications or narcotic pain medications and falling into issues there. So I think his podcast is really good. I think he takes a deep dive onto some critical issues in the healthcare ecosystem. But as a DPC doctor, I'm really disappointed that he has not taken a deep dive on direct primary care. He talks about how the cavalry is not coming to save us in terms of the big hospitals or big politicians coming in and fixing healthcare. But there is a grassroots solution that is growing across the country. Currently, there's about 1,200 family physicians who have opted out of the health insurance system solely to help their patients get better care at a lower cost. And we are the direct primary care doctors. We are the direct primary care movement. And we're really advocating for lower cost, better quality for our patients. And that's why we're out here every day serving our patients outside of the health insurance system, because we all know that the health insurance system is rigged against everyday Americans and even against doctors. Doctors are being forced to see more and more patients in less and less time, resulting in almost like a mill where patients are churned out to the next specialist to get even higher cost care that may not even be the right thing, as in the case of the back pain episode that was just discussed. And then on the patient side of things, patients have less and less time with their trusted family physicians. And there is a solution to rectify that. When you remove health insurance from the equation and you put doctors and patients together in a room and you allow doctors to contract directly with their patients and you allow patients to contract directly with your doctors, you can come up with unique solutions to these massive healthcare problems. If you want to talk about the cost of drugs being too expensive, well, what we do in our system is we wholesale medications. We buy 1,000 pills of metformin at a time, and rather than buying a 30-day supply of metformin for $10 at the pharmacy, you can now buy a 30-day supply of metformin at our office for 36 cents. So we just save somebody 99% on their metformin prescription, right? And we do that for a number of meds. We have examples on our website, plumhealthdpc.com. We also do the same thing for lab work. People talk about all the time getting gouged on their lab work. So let's say you want to check your cholesterol. That might be $150 at the hospital, but in actuality, it's $6 at our office. And then let's talk about specialty care. We are starting to leverage e-consult platforms where we can sit with you for 30 minutes or even an hour, take a complete comprehensive history of what you have going on, and then send it off for a second opinion at no charge to you through an e-consult platform. Same thing with imaging. People talk about getting a $3,000 MRI of their knee, or let's say a $3,000 MRI of their lumbar spine in the case of back pain. That MRI of the knee is $297, and that MRI of the lumbar spine is about $300. Again, a 90% saving on what people are getting gouged out in the health insurance system. So I think this is a really important subject. As you can tell, I'm very passionate about saving people money in the healthcare ecosystem. And frankly, that's my job as a direct primary care doctor in my direct primary care practice. Interestingly, we are in Southwest Detroit. We're in Detroit, Michigan. The income here in Detroit is $26,000 a year. So we're practicing in a health professional shortage area as well. So we intentionally set up our practice here because we knew there are so many underserved people who need access to great healthcare services. And it's affordable. Like the average income in our community is $26,000. Our memberships cost $49 a month for adults. That's where it starts for adults. And it's $10 a month for kids. So we've really come up with this affordable healthcare solution, and it doesn't cost people an arm and a leg, excuse the pun, to use our service here at Plum Health. And I can speak for many of the direct primary care doctors across the country. This ain't concierge medicine. We are here to serve people at an affordable, digestible cost that's accessible for a great majority of income earners in our country. We say if you can earn an income, you can afford a direct care practice. Put another way, if you can afford a cell phone for yourself as an individual, or if you can afford a cable bill for you and your family, you can afford direct primary care. So my message is to you, Dan, and the team at An Arm and a Leg. If you have the time, the bandwidth, the wherewithal to tackle direct primary care, we would appreciate it, because there are doctors who are working really hard and really diligently to find common sense solutions to these healthcare challenges. So thanks so much for watching, everybody. Have a great day. If anybody out there knows Dan and his team at An Arm and a Leg, I would love to chat with them. Thanks so much.